In this video, I'm going to explain to you what a doula does and how a doula can help you, presuming that you are a pregnant person who is about to birth a baby. So, the textbook definition of a doula is a trained birth professional who physically, mentally, and emotionally supports a pregnant person through pregnancy, labor, and birth. But what does that actually look like in practice? So during pregnancy, for me as a doula, I will meet with my client 2, maybe 3 times during their pregnancy in their home. And during these visits, we'll first go over their birth plan so that I am crystal clear on the type of experience that they want. And I can do my best to help them get that experience. After we talk about the birth plan, I will give them some evidence-based information and birth education, and this varies from doula to doula. Some doulas firmly believe that childbirth education is totally separate from doula support, while other doulas like myself believe that they kind of go hand in hand. If there's information about childbirth that I know will help you, and that you probably won't receive from anywhere else simply because maybe you don't sign up for a childbirth class, or the childbirth class that you take doesn't have this information in it, I am going to make it a point to get that information to you if I know that it might change your birth experience. So during the home visit, I'll go over some birth education, things like stages of labor. What does it mean when you have your water break? What is a mucus plug? So simple basic things like that. But I also like to get into comfort measures. How do you have a calm, peaceful birth? And how do you mentally and physically prepare for a calm and peaceful birth? Because there are very specific things that you can do, both physically and mentally, to get yourself into the optimal space in order to have the type of birth that you want. At these visits, we also will talk about things like things that you're afraid of, things that you need to deal with before you have your baby, just kind of troubleshooting, and we'll also be building a relationship, because for the next stage, which is labor support, when you are contracting and things are getting hard and you feel like you need some support, your doula is going to meet you wherever you are. Again, this varies. Some doulas will only meet you at the hospital. Others will meet you at home, at the hospital, on the side of the road, wherever you are. So for me, I tell my clients, whenever you feel like you need me, call me. So I'll go to the birthing person's home, I'll offer support there, and then I also will help them to figure out when is it a good time for us to transition from being at home to going to the birth center or going to the hospital. From there, I will follow my client to the birthing location and continually support both the birthing person and the partner through the process. Now, the support in birth obviously is a lot more rigorous. I'm going to be emotionally supporting by offering words of encouragement, affirmations. I'll be physically supporting them by offering them different positions to get into, by offering massage to them, using different pressure points. And when I say offering, what I mean by that is, let's try this, and if they don't like it, then we stop and try something else. Because as a doula, I'm there to support and gently guide, but I'm not there to control the situation. So we're there through every contraction from the time that you call us until the baby is born. Typically, most doulas will stay a few hours after baby is born. I like to make sure that baby gets latched on, or whatever the feeding situation is, mama gets repaired, recuperated, she's moved to her postpartum room, or she has, everything has died down. That's when I go ahead and leave. And then the last step that I do as a doula is either virtually, like through a FaceTime call, or in person, do one last visit to make sure that breastfeeding is going well, checking in on the emotions of the birthing person, and seeing in what ways they need help. Like if they need specific help in a certain area, I can offer that to them. So that is what a birth doula is. If you have any questions about what else birth doulas do, go ahead and drop them below in the comment section. Now, how can doulas help you if you are pregnant? So I have some statistics here. So getting continuous doula support has statistically shown to reduce the rate of cesarean, to shorten labor, to reduce the rate of forceps delivery, to reduce request for pain medication, specifically epidurals, and it heightens, increases your chances of having a spontaneous vaginal birth. So if you're pregnant, I highly recommend that you look into hiring a doula, because there is so much to navigate when it comes to pregnancy and labor and birth. And a lot of people think that they have to kind of just suffer through it. And birth can be a really beautiful experience if you have the right information, the right tools, and the right guidance. All right, that's all for today's video. If you learned something here today, make sure that you hit the subscribe button. And if you want to hear more from me, make sure you hit the notification bell so you know when my next video comes out. Thanks for watching.